Your Excellency, the President of the Republic of Kenya, Deputy President, allow me to acknowledge the protocols that we've established, ministers, colleagues, governors, and development partners, and everybody who is here. Mine is very simple, to welcome you to what I believe is one of the most consequential summits that have been held in this country, the Health Summit. Karibuni, Nairobi. Your Excellency, we have seen a true transformation in the health sector, and I can say it with authority as a governor. In many aspects, over the next 2 days, we'll have opportunities to go into the details of this transformation from our primary care networks, where we have, CHPs. In Nairobi, we have 7,820, covering 780,000 households, to the provision of essential services, Your Excellency, reduction of maternal mortality. Hospitals like Pumwani, which would be on the news every day for the wrong reason, have now 0% maternal mortality out of 16,500 deliveries. Your Excellency, we've seen hospitals like Riruta doing 100 deliveries in a month now. New maternity services in Kayole 2, in Mathare North, across the city. The story of the health transformation is something to talk about. We have facilities that would get 100,000 shillings in 2 years. In a year, getting 4 million shillings a month, allowing them to invest in healthcare and to invest in serving our people. Your Excellency, allow me to conclude by saying, because we'll get into all these details, today it was really just to welcome us all. Our constitution has been hailed as being one of the most progressive on the continent. It has mainly been hailed as being progressive because of the kind of rights. The first generation rights, Your Excellency, are civil liberties, where government is asked to step back to allow people to have the right to, do a number of things. But the second generation rights are what we call positive obligations. Positive obligations require government to actually do something. When people talk about constitutionalism in this country, constitutionalism is not just about maandamano or making noise. Constitutionalism is about fulfilling the constitution. The right to health would not fulfill itself. It has to be designed. It has to be planned. It has to be thought out. There has to be legislation. The right to housing will not deliver itself. It has to be planned for. And Your Excellency, I can say, and I dare say, if there has been a leader who has fulfilled the constitution of the Republic of Kenya, it is William Samoei Ruto, by these actions that you've taken. So people should not romanticize and preach on pulpits about Katiba. This is what Katiba is. Giving that right to every Kenyan, that health is no longer a privilege for the few. It is not a privilege for those who have money. That just because one person gets unwell, families have to sell their livestock, to sell their investments. What you're doing, Your Excellency, I believe this will be one of your most enduring legacies, the transformation of healthcare in our country. And I think our President deserves applause for what he's been able to do. Your Excellency, we are proud in Nairobi, in SHA. Mheshimiwa Moses Kuria was giving me an analogy because of the numbers we have. The most tech-savvy country in the world is Estonia, where we go to benchmark. The people registered in Nairobi and SHA are 2 times the population of the whole of Estonia. More than 3 million people registered and more than 1 million actively paying every month. And through the DHA dashboard, I can see who is self-employed, who is employed, and how they're doing. So we really thank you and want to really congratulate Mheshimiwa Duale. You have really led the way in healthcare. Your PSs, Oluga, who we are very proud of as Nairobi, and PS Mary Muoni. Allow me to also salute the thousands of community health promoters across the country who are bringing healthcare to the people. Before, we used to tell the people to go to hospital. These days with the CHPs, the hospital is going to the people. And that has reduced greatly the cost of health service delivery in this country. I'm sure that investment can be quantified by our minister and by the team here.